Hello everyone. In this video, we'll be discussing on the topic of the treatment of chronic heart failure. Okay, so it is just like an emergency condition, this heart failure, because it can occur very instantly. So it is very serious medical problem, and it is out of 100, one patient is usually suffering from this type of pathology, that is chronic heart failure, and mostly men's are in the section of gender. Men's get sick more often as compared to women. Now, what is chronic heart failure? So chronic, basic we will see. After that, we will see a treatment. And the chronic heart failure is a syndrome in which the heart is unable to properly pump the blood throughout the body. So the meaning is that when the heart is not able to pump the or eject the blood to organs and tissues of the body, then that condition leads to the heart failure. Okay, so in that case, the patient have many symptoms like shortness of breath. So like symptoms we can see shortness of breath, swelling of the lower extremities like edema. So there will be swelling in your edema. Okay, swelling in your ankles and all in the leg area, and wheezing we can listen in the lungs. Okay, and there will be cyanosis, that is bluish coloration of your lips, and other peripheral skin can turn into cyanosis due to lack of oxygen. Okay, because the heart is not able to pump the blood to other organs and tissues. Now, what are the main causes of chronic heart failure? Like arterial hypertension, very increase in the blood pressure, coronary heart disease, okay, cardiomyopathy, any congenital heart defects, arrhythmia, irregular heartbeat, obesity, weight high, diabetes mellitus, and some genetic factors can play a role to development of chronic heart failure. Now, what are the initial treatment which you will give to the patient with chronic heart failure? Is that first point we should remember is that we should limit the salt intake to 3 gram per day. So this should be limited, as blood pressure is can increase due to the sodium concentration. If the sodium concentration increases in the blood, that can lead to arterial hypertension. So we should decrease the level of the salt, and we should limit water intake also, because due to increase in water, there can be increase in the blood pressure due to the increase in the volume. Now we should reduce the body weight to normal, as obesity is main cause, and we should use tobacco or any alcohol and any addiction things we should stop immediately. We should engage in physical activity. So these are the first steps we should take. Now we will see, if we see in the drug section, what are the treatment we can do for the patient with chronic heart failure. Is that we can give the patient with ACE inhibitors. So the ACE full form is angiotensin converting enzyme. Okay, so this is an enzyme which actually helps in fluid retention and increasing of the blood pressure. Okay, so if we block this enzyme by giving the drug, so by that we can decrease the fluid and we can decrease the blood pressure. So edema will be okay, and the blood pressure will be decreased. So we will decrease the cause of chronic heart failure, risk of chronic heart failure. So it prevents excess retention of water, also has cardio and nephroprotective effect. So it will protect your kidney as well as the heart. And but side effect is that it can cause hyperkalemia, that is increase in the potassium level in the blood, and cough. So what are the ACE inhibitors? Are actually lisinoprils. The medicines which are ending with pril are actually ACE inhibitors, like lisinopril, captopril. Okay, captopril. So these are the most commonly used medicine in the case of ACE inhibitors. Now second, we have ARB blockers. So they ends with sartans. Okay, so they block angiotensin receptors actually. So the function is same, but they are acting on enzyme, they are acting on receptors. Okay, so they are prescribed with patient with asthma and ACE intolerance. So the patient who are intolerable to ACE inhibitors, are resistance to ACE inhibitors, so we should avoid in this patient. In that patient we should give ARB blockers, that is angiotensin receptor blockers, and the patient with asthma. So what are the medicines? Losartan, telmisartan, valsartan. So sartan, the medicine which are ending with sartans are ARB blockers. Okay, now we can give third medicine is beta adrenal blockers. So they will work on the beta receptors. So beta receptors are present actually mainly on the heart, beta 1 receptor specifically. So they increases actually the heart rate and reduces the heart muscle workload. So to reduce the because they are increasing the heart rate, so we should decrease the heart muscle workload by blocking this receptor. So we can give beta blockers like metoprolol and carvedilol. So we can give this medicine. So this is the third category. Now fourth, what medicine we can give? We can give calcium channel blockers. So we have two types of calcium channel blockers, like dihydropyridine and non-dihydropyridine blockers. So in this we have amlodipine and nifedipine, and this we have diltiazem and verapamil. Okay, so these are the medicine we use. So what they do, they actually dilates our blood vessel, decrease the blood pressure and load on the heart. Okay, so this is a mechanism. Now fifth medicine we have is diuretics. So diuretics actually increases diuresis, so because of that the volume in the blood will decrease, and due to that there will be decrease in the blood pressures. Now what are the medicines we use? We have thiazides. In thiazide we have medicine, thiazide is a category in which we have medicines like hydrochlorothiazides and potassium sparing diuretics. So in potassium sparing diuretics we have aldosterone antagonist and spironolactone. Loop diuretics we have furosemide. So we have three categories of drugs in diuresis. Ivabradine can be given in patients who are contraindicated with beta blockers. So ivabradine can be given, specific medicine here. Now what are the surgical methods we can do for chronic heart failure? Invasive methods. We can actually implant. Okay, so you can see some images here, like we can give pharmaceutical treatments like beta blocker, as I told you. In surgery we can give we can do bypass surgery, mitral valvuloplasty, left ventriculoplasty. So if the patient in severe heart failure, then we can do surgical treatment. If the reversion is possible, then we can treat it with drugs, conservative treatment. Clear? Now implantation, invasive methods, what we can do, we can implant the electrode so that ventricles can pump effectively, and device used to normalize arrhythmias. So we can implant inside, like one image I am having. So you can see this, implant cardiac defibrillator. So you can implant this fibrillator by electrical leads placing here, and we can stimulate the ventricles to pump the blood. So we can normalize the arrhythmia also, and heart can pump effectively. We can treat heart defects. Okay, implantation of heart valves, artificial and plastic surgery. Okay, and heart transplant we can do in severe chronic heart failure and who are resistant to conservative treatment. So the treatment which are not, the patient who are not showing any changes on drug therapy, then we can go for heart transplant. Now drugs that increase risk of this chronic heart failure are NSAID, non-steroidal anti-inflammatory drugs. Second is alpha blockers. Third is antiarrhythmic, actually specifically class 1A and class 1C, and lithium salts. So these are the drugs which should be avoided in the patient who are at risk of chronic heart failures. Okay, thank you.